So the Health Minister believes the strike action by nehawu members, which saw entrances to hospitals blocked, non-striking medical staff intimidated and patients left without care, has led directly to the death of at least 4 patients. Today, the Labour Court interdicting essential workers from taking part in the strike, as you've just heard. Well, the health sector has been battered by corruption, mismanagement, a global pandemic. And now it's been practically brought to a standstill this past week at some hospitals. Now, with the interdict, it does seem things may start getting back to normal. Let's discuss this now with Professor Alex van den Heever, Chair in Social Security at the Wits School of Governance. Prof, thank you so much for joining us. I would imagine that you've observed the events of the last week with a great deal of dismay. What are your thoughts as you've observed the way it's played out? With the Health Minister on the one hand pointing a finger directly at nehawu over at least 4 deaths, and nehawu is saying, we're not responsible.
Yeah, so it's been very concerning. The strike in many cases and the actions of workers on strike have been unlawful and have been harmful to the health system, harmful directly to patients. And that kind of conduct is concerning, particularly because these are meant to be health workers. And the patients in public facilities are the most vulnerable people in South Africa. They're sick, unhealthy, in many cases in need of critical care. And they're being denied that critical care by people who are asking for a raise. So the whole conduct is concerning because it also suggests that there is a widespread culture of disregard for the most vulnerable people in South Africa.
But do you think at the same time that some of the strikers would almost definitely be the very people that helped save lives during COVID? I mean, it just seems at such odds with the kind of sacrifices and heroism that we did see in many hospitals during COVID.
Yes, we did see that from lots of health workers. This doesn't seem to be consistent with any kind of reasonable behavior of a health system. So it does surprise me that you can go from one day to the next being supposedly interested in helping people in what is in essence a kind of a calling in a health system, and then suddenly completely behaving in the complete opposite because you're after a raise. I think that this is a concern because it does suggest that in many cases some people do actually behave along these lines when they're actually at work as well. There are serious problems with the way in which the public health system is operating and the way in which many of its accountability systems are currently operating. So I think that the question really is whether this culture that we're seeing in the strike is actually consistent with the culture of many people at work as well. And I do think that this requires a very hard look at the way in which the public health services are managed.
Yeah, you know, one of the themes that's come through over the last week is there has been a lack of leadership, whether it's leadership within nehawu, calling its members to order, or even deciding how members should behave, or on the side of government, which has been strongly criticised for reneging on the 3rd year of that wage agreement and then imposing that 3% increase last year, and now just presuming they can carry on and continue with negotiations. Do you think that leadership plays a role here, or do you think it's more a comment on a society that's getting increasingly desperate?
I'm not sure that this is the desperate part of South African society. I mean, in many senses, the people working in the public health system are relatively well paid. They all have medical schemes. They don't use the services that they're working in. Other people use them. So they're in many ways insulated from quite a lot of the hardships in South Africa. They're employed, earning an income. We have millions of people who do not have that, who are truly suffering. So the suffering is very often of the people who have to use the public services rather than the people who work in it. And so this is part of the concern. In the case of government's conduct in this, they've been heavily criticized, and I think rightfully so, for being very slow to come to the party, very slow to take concerted action. It's been very good that they took this legal action, but they failed to protect public services and access to public hospitals in the early stages of the strike. And they effectively left very vulnerable staff open to attack. We've seen young interns, in hospitals working in Mpumalanga being attacked physically assaulted by a sort of a gang of people in a room, carrying her out. And that is within the context of a government that claims to be sensitive to gender-based violence. It's just obscene. And that's quite aside from the more vicious acts of violence that we've seen overall and the deaths that have occurred. And it's quite certain that a lot more people would have died when the investigations are done than the 4 that have been indicated by the department. So I think government has basically been accused of tiptoeing around nehawu, which is a concern. So they now do have to step up to the plate and protect our public services, which they haven't really been doing properly to date.
One of the people that I interviewed from the Progressive Health Forum, she described it as a human rights catastrophe. I also interviewed Geraldine Fraser-Moleketi, who at one stage was a Public Service and Administration Minister. And she made the point that even during wartime, the medical services are always allowed through, or should be. The fact that this was blocked in peacetime South Africa, in a democratic country, do you think it speaks as well to, I mean, we've spoken about the lack of leadership and failures on all sides here, but do you think that there's also an issue around lawlessness and lack of consequences, and that government needs to take a very firm line on this issue?
Yes, so let's start with the issue of consequences. Many of the people committed these acts of violence on film. It's very clear who they are, and they should be, nobody who attacks anybody or prevents any patient or any staff member from accessing a health facility, those persons should never be allowed to work in a public health system ever again. So disciplinary action, at the very least, aside from criminal charges, should be laid against those individuals. Civil action can be taken against nehawu itself. They might say, oh, well, we're blameless for this. This is some unruly elements. But clearly they're part of setting this up and allowing it to happen. They didn't stop it either. So these are the actions that also allow for accountability to occur. Part of that responsibility falls on government actors who do need to take these people to task. But we have seen that in many cases where particularly unions have abused public services and civil servants, patients, etc., that there is no action that results. And it suggests that people are basically either treated with kid gloves or they're protected. So I think that is a concern. These people who committed these acts must be removed from their positions, and that should be the way we pursue it. And unfortunately, the various departments of health have not done that to date, but they should be.
It's interesting, we're going to hear a press conference from the Health Minister at roughly 7:30, which we're going to take live. It will be very interesting to see what he has to say. I'm wondering, we've heard from nehawu that, and Kasatu, who I spoke to earlier this evening, that there were ongoing attempts to resolve this wage impasse, and that government pretty much walked away from the table at one point. Is there... The reality is that, these essential workers have done extraordinary things during COVID. They're not fantastically paid. They could be better protected and paid. But how else could they have put their point across, besides going on strike, hitting a sector that is absolutely crucial for people? I mean, just trying to think, what are the things that are not being done that could be done now? It seems that talks just continue and continue and continue with no real resolution.
Well, first, that is actually an issue for them to consider. What is the ethical way forward? What you don't do, I think that's very clear, is no matter what this cause is, you don't attack patients, you don't threaten their lives, and you don't hold a gun to the head of vulnerable patients and staff, but in particular the vulnerable patients, and say, it's your fault if I shoot you through the head. That's thuggish behavior, and there's no breakdown of negotiations, no impasse that justifies that action at all. That is the action of entitled thugs, and should not be condoned in any way. So really the way in which that particular issue is resolved in a coherent way has to be dealt with by adults in the room negotiating properly. The merits of each party's case has to be basically deliberated on and dealt with. It is also an issue that government is dealing with the fiscal and financial consequences of COVID as well, the knock-on effects of the recession, and now the knock-on effects of the collapse of eNCA, which is impacting substantially on South Africa's economic growth and its government revenue. There are going to be consequences in government and public services because of that. That discussion has to be held. What you don't do is say, well, the way in which we resolve not getting our way is to then attack vulnerable people as our solution. That is not the solution, and no reasonable person could see that as a logical way out of this.
Yeah, a line you simply do not cross. Thank you so much for speaking to us this evening, Professor Alex van den Heever, Chair in Social Security at the Wits School of Governance. Now, still